Hi, this is Mr. Ho from Blueprint Vision, and the video today is about how long will the effects of laser eye surgery last. The first thing to understand is the length that the effects of the laser eye surgery last depend on whether your prescription to start with is minors or plus. If we start with minors or the myopes, the vast majority of myopes will typically have the effect of the laser lasting 10 to 15 years. It's partly dependent on you as an individual and partly dependent on your age and how severe your prescription is to start with. As a good guide of your myopic progression, so how likely are you to progress anyway, if you look at what your prescriptions changed over the last 10 years, it'll give you a good indication of what the maximum is likely to progress over the next 10 years. So if over the last 10 years you went from -3 to -6, then making your prescription 0 now means that over the next 10 years you might still end up at -3. Admittedly, your prescription changes less as you get older, but that's just a good rule of thumb. If, however, your prescription is plus or hyperopic, then unfortunately the effects of the laser are likely to last much less. I have anecdotally seen the odd patient who was hyperopic and their laser lasted them 10 years, but what I say to patients is that I expect hyperopic laser to only last about 2 to 5 years. And that's based on my real world experience. And consequently, I personally treat very few patients who are hyperopic because for the vast majority of these patients, the value proposition of having laser eye surgery, knowing full well it might only last 2, 3, or 4 years, isn't a great one. I'm very transparent to the patients about what they can expect, and that's why I treat very few patients who are hyperopic, because once they understand that it may not last very long, they often choose not to go ahead with the surgery. I believe it's just better to tell them the honest truth and allow patients to make their own decisions. Thank you for your time.